Antiphospholipid antibody syndrome, also called APS, is an autoimmune disorder in which the body recognizes certain normal components of blood or cell membranes as foreign substances and then produces antibodies against them. Patients with these antibodies may experience blood clots, including heart attacks and strokes, and miscarriages. In fact, APS is the cause of 1/3 of strokes that occur in young people. APS is sometimes called Hughes syndrome, or sticky blood. The most commonly measured antiphospholipid antibodies include lupus anticoagulant and antibodies to cardiolipin or beta-2 glycoprotein. There are two types of APS, primary and secondary. People with primary APS do not have any associated condition. The secondary form is associated with another immune disorder, such as lupus, an infection, or rarely the use of medication. 1 to 5% of the population is believed to have APS. 75 to 90% of APS sufferers are women. 10 to 25% of women with recurrent miscarriages have APS. Many people's lives are affected by this syndrome. My little sister is very special. She is a fun, energetic, feisty, brilliant human being who is almost never born. My mother has antiphospholipid syndrome. This caused her to lose 4 babies during her pregnancies. APS has had a devastating effect on my life as well as the lives of many others. Thankfully, due to advancements in modern medicine, doctors were able to diagnose my mother after her 3rd consecutive miscarriage and started treatment. Treatment is often intensive, and many medical professionals are involved in the treatment process. Treatment normally consists of prescribing powerful blood thinners called warfarin or heparin. Heparin is used for pregnant women because warfarin is not safe for a developing fetus. Heparin is currently only available as an injection. My mother had to inject heparin 1 in the morning and 1 at night for her entire pregnancy. There is no cure for APS, but there is treatment. The treatment of choice for patients with APS who have blood clotting issues is anticoagulant therapy or blood thinners. Some people may have elevated antiphospholipid antibodies but no clinical manifestations of the syndrome. For this condition, it is treated with aspirin. Aspirin reduces the risk of blood clots by making the platelets less sticky. Studies are ongoing to determine how helpful aspirin is and whether low doses of anticoagulant might be more effective. There's no known way to prevent APS, but there are ways to prevent blood clotting. You can quit smoking, increase your physical activity, and avoid medications that are known to increase blood clotting or even cause APS. Some people can actually lose the antibodies associated with the syndrome. This can be following a viral infection, a pregnancy, or after taking medications that are connected to APS. We don't yet have a lot of good ways to shut down the immune response. What we do now is treat the symptoms, which is the blood clotting, not the underlying cause. The better we understand the underlying cause, the more ideas we can form to treat it. Scientists are now looking for ways that could possibly target B cells in particular. If you're interested in a career that works with antiphospholipid syndrome, you could become a researcher, you could develop medicines, you can become a doctor, or you can become an OBGYN if you're interested in the syndrome's effect on pregnancy. Although APS is one of the more common autoimmune disorders, a lot of primary care doctors remain uninformed about it, and they don't test for the antibodies soon enough or even at all. Unfortunately, many patients have to see several physicians and specialists before they get the proper diagnosis, like my mother. It took her about 5 years to be able to get the doctor to give the test, get the right diagnosis, and find the people who could help with the problem. The type of doctor that a patient sees should be determined by the symptoms that that individual patient is having, and often patients will need to see several different specialists. For patients with blood clots, a hematologist would need to be consulted, especially to deal with the anticoagulant therapy. For patients with recurrent miscarriages, a high-risk obstetrician should be consulted. Hopefully in the future, researchers will be able to discover more ways to treat the syndrome effectively. I am grateful for the current research and treatments that have been developed so far. I am grateful for the medical and scientific research that has benefited so many families just like mine. Sometimes, when studying these syndromes in a scientific way, people seem to be in the background. But the truth is, this affects real people and real lives.